pain in the middle of the back or mid-back pain or thoracic pain, this is a very common entity. Normally, any pain that happens in this part of the spine is known as mid-back pain. So basically, now what are the causes for mid-back pain? The most common cause for mid-back in young patient is poor posture or muscle weakness or vitamin D deficiency. In older age group, it can be because of facet joint pain, or it can be because of infection, or it can be because of tumor or intercostal neuralgia. So when we talk about young patients, normally poor sitting posture is the main cause of mid-back pain. So if the patient is in habit of sitting like this, then this part excessively stoops, and that can lead to mid-back pain. Similarly, if the muscle tone or muscle power is not good, that can also lead to mid-back pain, which is more commonly seen in young female patients. Also, Schurman's kyphosis is a possibility in which there is wedging of the bones. Because of wedging of the bones, the posture becomes stooped. Like normal standing posture is like this. In Schurman's kyphosis, again the posture becomes like this. And there is a hump here at the back. So because of that also, there could be mid-back pain. In adults, the most common reason is facet joint related pain. That means because of the joints of the spine. So in spine, we have joints, and each joint is locked like this. And in this joint, the movement happens that allows us to do the rotation, right or left. So what happens if there is overloading of this facet joint? That can lead to mid-back pain, and this is the most common reason. Except for this, there are conditions like infection that can also lead to mid-back pain, especially in conditions like tuberculosis or pyogenic infection, in which movement becomes very painful. There might be fever, there might be rest pain, sitting might be painful. So this is a special condition where infection is destroying the bone. Next comes a special mention about intercostal neuralgia. In intercostal neuralgia, because of the pressure on the nerve that travels through the rib cage, there is pain that radiates through the chest wall. So this part, when becomes painful, it could be because of intercostal neuralgia due to a tumor which is pressing onto the nerve, and the pain radiates along the nerve. So these are the most common reasons, and depending upon how severe your pain is or what your presentation is, your doctor might investigate by either getting vitamin D tested or X-ray or MRI. So normally by MRI or X-ray, we are able to diagnose accurately what is the reason for mid-back pain. So based on that, the doctor might suggest you treatment like posture correction, wearing a special posture brace, or using a special kind of chair, or regular exercises, especially back extension exercises. Or if there is a deficiency of vitamin D, he might advise you vitamin D supplements. If nothing works and the MRI is showing infection, then of course the treatment is different. Like in tuberculosis or any other sort of infection, the treatment depends on what kind of infection it is and how much bone is destroyed. So it might require a surgery if the infection is very severe. Now coming to the last thing, but the most important thing, that is the facet joint related problem. If the pain is because of facet joint related problem, and if it is not going away by posture correction, muscle exercises, wearing a brace or medicines, then we sometimes give radiofrequency ablation or facet joint block in the thoracic spine. This is a procedure which takes 15 minutes. It is done in operation theatre under local anesthesia. And here we specially target that area that is producing the pain. That means the facet joint, the joints in the mid part of the spine. So when we do this procedure, this takes care of majority of cases of mid-back pain. However, if there is intercostal neuralgia, that means the pain that is traveling along the ribs, then we might require a procedure to make the nerve free. Now, it might be a surgery, a tumor removal surgery if there is a tumor, or if there is any bony overgrowth, then that might require removing it. Or sometimes we give medicines or pain procedures for intercostal neuralgia, which is intercostal block. So depending on what kind of symptoms do you have and what your MRI investigation is showing, your doctor might suggest you treatment. Thank you.